So, Bismillahir Rahmanir Rahim, the male reproductive system terminology. Because please mute your speakers. Because you have not been introduced to the parts of the system. So, before talking about the terms, we will go for an introduction to the male reproductive systems. So when you will finish this activity, this lecture, you will be able to recognize the parts of the male reproductive system. You will be able to pronounce, smell, and define medical terms related to the reproductive system, normal reproductive system, and its disorders. There will be some abbreviations, some pathological terms, some terms about the diseases. So all this will be clear, inshallah. So let us go to the parts of this system. As we have talked in female system, that we have got the different portions, different organs in our body, which we utilize for reproduction. Reproduction means that to reproduce children, to increase the to have the next generation. So for male reproductive system, the major components, major organs, they have been shown in this section. This section is the section of a male body taken in a sagittal plane. So that means we are looking half of the body because we are concerned with the pelvic region. So we are looking at the organs contained in the pelvis. So if you come over here, we start from a first organ, that is the testis. Now when we will use the term for this, different terms are shown in this. We will discuss this in next slides, but this is the site. This is the factory where the main product for reproduction, that is, we call it semen, is produced. We will study the details of this organ in biology. Basically, sperms are the living cells which carry all information of our body from our father side, from male side. So each sperm, as we have seen in female system, like ovum, is a mature. When it is mature, it is haploid cell, and haploid means that it has got all characters written on the genes in a number made to half. So 46 has been, 2n has gone to 23 to n number. From diploid, this cell is haploid. So this sperm will meet with the ovum. The process of fertilization will take place, and then it will create a new cell that we call zygote. All of us started as a zygote. Now this zygote, a single cell, will multiply, will divide, and we will get millions of cells which will make different portions of our body. So this is very basic cell. The sperm contains these cells which are carrying all information from paternal side, from father side. So this organ, testes, the male has got a pair of testes. They are enclosed within a sac that we call scrotum. So the scrotum is a bag in which this organ is enclosed. Now this is an external organ. So basically, when we will study more, we will find that this organ has developed in the abdomen during development, but it has come down, descends down. So when it has descended down, it is kept in the scrotal sac. So now second word to introduce duction is scrotum. So testes and scrotum. Now from here, when the sperms are produced, if you see on this side, if we cut this a section of the sperm, we will see in the next slide the various compartment or chamber in the testis can be seen, which we will call as the seminiferous tubules. So these tubules, they are the sites where sperms are formed. We will see the next slide, and then this section. This is section of a testis. This testis has been taken out. It has been cut in a sagittal section, and these are all chambers. These are all chambers where we have got tube-like structures, and these tube-like structures, they are labeled as seminiferous tubules because of small size. Now each this testis is containing number of compartment which are labeled as lobules. So these all lobules, they contain seminiferous tubule. Now this seminiferous tubule, if we take out a tube and we make a section of it, we can see that this section, because when we cut a tube, this portion, this area, we take out a tube. So this tube will, I'm trying to have a section, a pen. So this tube will be containing the seminal fluid. So from all these seminiferous tubules, they are, please mute your speakers. All these seminiferous tubules, they have summed up, they have been collected over here, which is portion that we call epididymis. This is all different parts of the epididymis, and then from here, all the tubes, they collectively make a single tube that we call vas deferens or ductus deferens. So this ductus deferens will carry the seminal fluid forward, and we will see that above to the testes and scrotum, we can see a collection of blood vessels, vein, artery with a nerve, plus the vas deferens collectively labeled as spermatic cord. So spermatic cord is a collection of blood vessels, the vas deferens or ductus deferens with a nerve, and the ductus deferens is carrying the seminal fluid. Now this seminal fluid will be traveling from seminiferous tube to epididymis, ductus deferens, then it will go to ejaculatory duct. If you see over here, this is the vas deferens, and from here it will, please mute your speakers. So this ductus deferens will go like this, and it is over here. And if you look over here, we have addition of some extra glands which are over here, like the glands, this flying, one of the major glands, that is the prostate gland. And then it will go down, and this duct will, from ductus deferens to ejaculatory duct, and it will enter over here in the urethra. And if you recall back urinary system, this urethra was the part which was discharging or taking out the urine from urinary bladder. So when we will see this portion, this is the part of the urinary bladder, the ureter from the kidneys carrying the urine over here. Then we have got the ejaculatory duct which will open over here. At this region, this portion of the urethra passing through the prostate, we will call it prostatic urethra, as we have talked in the male urinary system. Then this portion will go down through the penile urethra over here. So as this urethral portion is carrying urine plus through this ejaculatory duct, the seminal fluid. So from the urethra, it will go down through the penile portion and it will exit the body. Now this portion, this act that we call ejaculation. So from testes, in spiniferous tubules, seminal fluid or semen is produced consisting of sperms carrying all genetic information from father's side. It will travel through epididymis, ductus deferens, or the ejaculatory duct. Here it will get some secretion from prostate, some other bulbourethral gland in the urethra, and seminal glands over here, seminal vesicle. So this is the pathway of the sperm. And now please remember, in male system, the urethra is carrying urine plus the sperm. So it is the urogenital pathway. It is the urogenital duct. In case of females, we have seen the female body has got separate urinary passage and separate birth canal. So these are parts of the system that we will study today. So let us see that which terms we need to study for this system. Like the female system, like all other systems of our body, we can examine these systems in a living person, in a patient. So if you look over here, we talked about this gland, the prostate gland, which is covering or enclosing the urethra, the prostatic part of the urethra, and it is getting the communication with the ejaculatory duct for the passage of the seminal fluid. So this area, this gland is very notorious. In old age, this gland can become enlarged. Now this gland, this enlargement is of two types. One, we call it benign prostatic enlargement. So this is a benign condition. And the word benign we have used in another system also. When the growth or the growth is the growth of the system or growth of an organ which gives it enlargement, and it is not dangerous to the body. It is benign. But sometimes it can convert to malignancy, to cancerous type. So when it is cancerous growth, this prostate cancer should be treated immediately in old people. So if you look over here through this prostate, the urethra is crossing. So urine is passing through this or going out through this part to the penile urethra. So when this gland becomes enlarged, it will press the urethra. It can close the urethra. So this will lead to the problem in the urine. Now these problems, for example, difficulty in passing the urine, or for example, the person have to rush to the toilets, that we call urgency. Immediately he has to pass urine. He cannot stop or cannot wait for the urine to pass it or to reach the toilets. So urgency. Also, he will have problem that he has to get up at the night for passing the urine. This we call nocturia. So we will see these terms and further. Now, in a living patient, we can examine this portion, the urinary bladder and prostate, through a special instrument that we call cystoscope. Now, again, the cystoscope is consisting of two words. The word cyst is for urinary bladder and scope is for to examine. So cystoscopy is the process of examining or looking into the urinary bladder in a living status, in a living patient. So we can even see that the prostate is enlarged, or is it of normal size, or We can even take biopsy and we can examine this biopsy and we will give. So the examination of urinary bladder in a living patient with a special instrument is cystoscopy. Cystoscopy is done by this instrument that we call cystoscope. So we can examine what is the condition of urinary bladder and prostate through this exam, through this procedure. So let us go to the terms. We have the second, if we go back, we have seen the parts again to revise. The testes, the duct system, tubular system carrying sperm opening the urethra, and penile system, the penis. So penile cyst organ and testes enclosed to the scrotum, these are the external organ. Inside our body, male system has got the glands, seminal vesicle and prostate, and this whole ejaculatory, this system of ducts, tubes for the passage of the sperm. So we will be using these terms. First, a set of terms which are combining form. Belano, this is concerned with penile organ. For example, you are familiar with itis, balanitis, the swelling of the penile region. Any swelling that will occur in this region will be labeled as balanitis. Then for testes, we will be using the term arco. So this is orchitis, for example. Example is given. So meaning is the swelling, inflammation of the testes. Then we have term archeo, archiectomy. You are familiar with ectomy and archi. Anybody who can tell that what this word will mean?
Remove the tissue.
Removal of the testes.
Removal or cutting of the testes. Then look at the next term, archido. This is also concerned with testes, archido, ectomy. So this is a again for testing. Then for prostate gland, we will be using prostatectomy.
Removal surgical prostate gland.
Yeah, removal of the or cutting of the prostate gland in a surgery. As we have talked that it can change into, it can enlarge in old age and press the urethra. So problem with the urination. So we have to remove this organ by surgery. So we can have prostatectomy for the enlargement, either benign enlargement, PBH, we call it prostatic benign hypertrophy, PBH. Or we can, if God forbid the person has got cancer, then we have to remove this gland, prostatectomy. Then for scrotum, we will be using the scrotal. For example, scrotal sac we have used for where the testes are enclosed. Urethro, for urethra, urethritis. So this term, then let us see the terms for the roots. On one side, you will see the roots, another, we will see the disorders, various disease conditions. So roots which we use for medical terminology for male genital system, the number one is testo, as we have seen in the previous slide. The testo concerned with testes, testicles, testicular, that means related to the testes. So for example, testicular artery, testicular vein. So we have some procedure of the testicular processes. For example, surgery, testicular surgery. So this word is concerned with the testes, related to the testes. The second term for this, as we have seen previously, archeo or archido, for the anarchism, absence of the testes. By birth, if the testes have not, as we have talked early, that testes they develop during development in abdominal cavity. Then they descend down into the scrotum before birth. Sometimes they are not able to reach to the scrotum, then we call them undescended testes. Undescended, they have not reached into the scrotum. So this is, the testes have to be put back into the scrotum by surgical process. So we use the word archido. Then we have got semen, the semen, the seminal fluid. Inseminate, to introduce semen into women. Inseminate, for example, we have a process which we call in common layman's term as test tube babies. We can have an ovum in a laboratory, put the sperms of the husband on it and fertilize the ovum outside the body. When zygote is formed, we transfer this zygote to the body of the mother. That means into the uterus. So then child will develop, embryo and fetus will develop over there. So this is called artificial insemination. So verb is inseminate. Then we have got the other word for sperm or spermato. For example, oligospermia. So spermia is related to sperm. Then we use the oligo. We have used this term before in urinary system, for example, oligouria. So this is oligospermia. This means deficiency of sperm. Millions of sperms, if they become less, produce less, that will affect the fertility of a person. So this is oligospermia. Then we have epididymo. As we have seen, part of our male genital system, epididymis. So it can lead to swelling, epididymitis, inflammation of epididymis. Then we have vaso, concerned with vas deferens. Also it can be for a vessel. Vasorrhaphy, suturing. Rhaphy is for suturing, to stitch it up. Suturing of the vas deferens. Vesiculo, seminal vesicle. We have seen the extra glands, accessory glands in the male, prostate gland, seminal vesicle. So we have got this word, this root pertaining to the seminal vesicle, vesiculo. So for example, vesiculography, if we make an X-ray, putting some material, colored material into the seminal vesicle, taking an X-rays, that is vesiculography. Then we have the prostatometer, instrument for measuring the prostate, size of the prostate, for example. Oscheo, scrotum, also for the scrotum. Osteomas, tumor of the scrotum. Then if you go to the second chart, let us put them here. So these are different disorders which we can see in case of male genital system. So one, we have talked the very, very notorious problem with old age, PBH, benign prostatic hyperplasia. The enlargement of the gland, enlargement of the prostate gland. With the age, this gland usually gets enlarged, leading to the problems in passing the urine. So this BPH, benign prostatic hyperplasia, or PBH, some people write it, prostatic benign hypertrophy. So this is a non-malignant, not malignant. It changes, this enlargement changes to cancerous state, then we will call it the malignant. Then we have got the term cryptorchidism. As we talked before, the testes, they develop in our abdominal cavity. Then they come down at the time of birth. Before the birth, they reach to the scrotum. So if they fail to reach, they are called undescended testes. And undescended, the other word is for the term for this is the cryptorchidism. Cryptorchidism. So cryptorchidism is undescended testes. Now, another thing we have, it is not added over here, but just to add to your knowledge that these undescended testes, if they are lying in the abdomen or in the pathway coming down to the scrotum, they should be put back into the scrotum by surgery. So we call this as orchidoplexy. So we have got cryptorchidism. Then epididymitis, we have seen it over here. This is the term for inflammation of the epididymis, the tube, the duct system for carrying the seminal fluid. Now, this is a common result from urinary tract infection and sexually transmitted diseases. These two abbreviations, STDs, sexually transmitted diseases. For example, transmission of an infection, spread of an infection takes place by different routes. And nowadays we are all familiar with the COVID. What is the route of spread of COVID? How the COVID spreads? Anybody who can answer?
Sneezing.
Sneezing. So this is respiratory, or by sneezing, by coughing. Similarly, some of the diseases, they can only reach to the other person by sexual contact. So these are sexually transmitted diseases. Once upon a time, an old time, when antibiotics were not there, these diseases were very fatal, very dangerous. Now, out of these, we have some of the diseases still persisting there, like syphilis, gonorrhea. So we will see and we will study them in the coming years when you join with medicine. So we have STDs and urinary tract infections, that is the infections for the urinary system in any way, for example, the urethra. Then another term we use, erectile dysfunction. This is an inability for the male for erection of the penis. So this is failure to initiate or maintain an erection till the ejaculation for seminal fluid. So we have got a condition, impotency, that will lead to impotency. So impotency and erectile dysfunction, both are explained one after the other. When the person is unable to or decreased capacity to produce the children, that we call infertility. Then inguinal hernia. Now, word hernia, we were introduced in the study of gastrointestinal system. Any normal content of our body, for example, of abdomen, if it is pushed out through any region, for example, through the umbilicus or through the inguinal region, that we call herniation. So herniation is protrusion or coming out of the abdominal cavity. Normal structure is normal. For example, a part of our intestine, part of our any internal organ, if it is pushed through the inguinal region, then we will call it inguinal hernia. If it is pushed out through the umbilicus, we will call it umbilical hernia. Now, in our lower limb, upper part, we have got femoral area. So femoral triangle, we will study it in further years. So if something is pushed out in the femoral region, that we call femoral hernia. So we have protrusion of normal structure of the abdominal cavity out, and this can be umbilical herniation, inguinal herniation, or the femoral herniation. Then we have term architis. We have seen the term previously, archeo, concerned with testes. So inflammation of testes. It can be caused by injury. Any injury to the testes can lead to its swelling. Then there is one virus infection, very dangerous infection. Usually it takes place, can occur in childhood. The child will become infected. And if you look over here, we have got a gland over here for salivary gland, parotid, which creates saliva, that we have talked in GIT system. So this gland gets the infection by this virus and it swells up. But problem is, that if not treated well, this will affect down to the testes, and it will lead to inflammation of the testes, leading to impotency, leading to less functions, less number oligospermia, for example, or damage to the formation of the sperms. So architis due to any cause is a serious condition. Then for prostate swelling, prostatitis, this also occurs with urinary tract infection, sexually transmitted diseases, or number of other problems. This is the same STD, sterility, complete inability. So we have two terms. For example, we have impotency. This is erectile dysfunction. Then we have infertility. But compare infertility with sterility. The sterility is complete. Person is unable to produce any children. But if it is a decreased capacity, then we will use infertility. So this is basically both terms are for less, decreased, or absence of the production power. So we have got sterility. The person becomes sterile. The subjective form we will use sterility. Sterility will be sterile. Then urethritis, swelling of the urethra. This is again caused by infections like gonorrhea is a sexually transmitted disease. Then we have chlamydial infection. So these infections that cause swelling of the urethra, urethritis. Now we have some of the procedures which have been mentioned here. Previously, we have seen that we can get any normal structure coming out through the abdominal wall in the inguinal region or umbilical region or femoral. So this normal structure should be pushed back into the abdomen by surgery. So this surgery is called herniorrhaphy. Hernio is the same from hernia, and rhaphy is the stitching, surgical repair. So we have got the process of herniorrhaphy. This is a surgical technique, a method, a surgery which will reduce the hernia. When we put back the hernia into the proper place, back to the abdomen, this is the herniorrhaphy, repair of the hernia. Then we have prostatectomy, as we have seen before. If this gland, prostate gland, becomes cancerous or benign enlargement, it will cause problem in the urination. So we have to remove this gland. This is called prostatectomy. Now this prostatectomy can be done. For example, we can open the abdominal cavity and pelvic. We reach to the pelvis and we can remove the gland. Or we can go through the urethra, through the penis, through the urethra, put some special instruments and can cut this gland. So we will call this transurethral prostatectomy. Transurethral means through the urethra, or per abdomen, abdominal prostatectomy. Then we have the next term, vasectomy. This we have axion of the vas deferens, ductus deferens. Now, this surgery can be done for family planning, contraception. Contraception is the method of planning the family. If the parents, both mother and father, decide not to have children, then we, in males, we can cut this vas deferens, then sperms will not reach, will not be there to fertilize the ovum. So this is process vasectomy. Now going further, more information, because this enlargement of prostate gland is a very notorious problem. This is the same non-cancerous enlargement of prostate gland. So we call it benign prostatic BPH, or BPH also stands for benign prostatic hypertrophy. You are familiar with the word hypertrophy. In previous, this term has been used. Cryptorchidism, when testes are not descended Crypt means hidden. Then hydrocele, look at the words please. Hydro is about water. Then seal is, there is a sac which contains water-like material, and this is bulging or swelling. So hydrocele, collection of fluid in the scrotal sac. If we have got a vein near on the testes which is swollen up, then we call it varicocele. So please look at two terms. Hydrocele, if there is a collection of fluid, then if the blood vessel, venous system, venous vein is swollen up, then we will call it varicocele. So varicocele means swollen veins. Hydrocele, it indicates a collection of fluid in the testes. Then we go further. For all these, we have got some of the procedures which we will revise. So we have got a term over here for laboratory test to differentiate, to diagnose the disease. So very famous test, as we have talked, that the PSA, the prostatic enlargement with the age, is a common problem with old age, with old male persons. So they have found out that due to swelling or due to cancer, any other problem which can increase the size of the prostate, in blood we have got a specific antigen which increases. So we have a normal limit of the PSA in our body. All males, they have a normal level of PSA. If it goes increase, then we have further checkup to see what has caused this enlargement. Yes, please. What she wants? Somebody is raising hand. So we have PSA test, very common test for old people to check for the enlargement of prostate. Then semen analysis. We have talked that seminal fluid is produced the testes. This is the fluid which contains the living cells that we call sperms. When we analyze this fluid in laboratory, this is called seminal analysis, semen analysis. We measure the number of the sperms. We see the shape and motility or mobility of the sperm. That means their ability to move. For a normal person, we have some parameters that a normal male should have a some range of the number of sperm. If they become less from the normal range that we have already seen, we call it oligospermia. So seminal analysis will tell us, and we will see this, and we will examine this in persons who have no children, to check for the reason. Then we have the transurethral, the full term is TURP, transurethral resection of prostate gland. That means we will pass an instrument through the urethra, reach to the prostate gland, and we will cut it or we will remove it. So this is through, this instrument is endoscope. So we will put an endoscope in the urethra, and we can remove or we can cut or we can resize the prostate gland. Vasectomy, in which the vas deferens on each side can be tucked. This we can be, or it can be ligated. Please look at the term ligated. It can be cut. If we cut the vas deferens, it will be permanently, person will not get the sperm to reach out. If we tie it, we can release the tie after some times when we want, and then again person will become fertile. So an infertile person, due to make person infertile or to stop children, further children, we can do this vasectomy. So this process, this is a process of contraception. And this is a common practice when we have want to sperm to be not reaching. Then for all these, already we have seen, for example, benign prostatic hyperplasia, BPH. Then to examine the prostate gland, we can, when there was, nowadays we have lot of instrumentations, like we have ultrasound, MRI, all these are the various diagnostic procedures, various methods to diagnose the diseases of the prostate gland. But the best and easiest and cheapest method, which every doctor have to learn, this is digital rectal examination with our finger through the last opening of our GIT system, the anal canal, anus. We can feel and we can see the size of the prostate gland. So this is, some people they write per rectal examination or digital rectal examination. Then genitourinary concerned with the genital system and urinary system. As we have talked that in males, the urethra is a genitourinary passage. It allows the passing of the urine plus the sperms. In females, we have a separate genital tract, that is the birth canal, and separate urinary tract. PSA, prostate specific antigen. This is an antigen which increases from normal range in enlargement of the prostate. STIs, sexually transmitted infection, or STDs. Some people use the word STD. So sexually transmitted disease, like we have named already, gonorrhea, syphilis. So these diseases will only can be transmitted by sexual contact. So these abbreviation, TURP, we have already seen, transurethral resection of prostate gland. That if the prostate gland becomes enlarged, maybe benign or cancerous, it is pressing the urinary urethra. So problem with the urination, so we have to cut it, we have to remove it, resection it. So this is transurethral resection of prostate gland. Now in your further pages, you will see these exercises. They are all concerned with the same male genital system, and many of we have done over here. The key for these is there. This is an exercise number 2. You have to label all parts. This is for your practice, and key is there. Then we have matching. For example, in first exercise, you will come to the gonads. So out of all these selections, you have to select the proper word which can relate to these glands, these terms. So what will you suggest? Please have a look at this gonads. Out of these 5, which term which you like to add with the gonad, with glands, for example, with epididymis, with androgen, with prostate. So if you look over here, prostate, just now we talked a gland related to the bladder, located in the bladder in the male. Then below the bladder, then we have got androgen, the male sex hormone. Then we have epididymis, the coiled tube on the surface of the testes. Then we have glands, the end of the glands, the gonads, the sex glands. Similarly, we have these. So you will go through this. For all these exercises, key is there. Then the last part of this is about case studies. Now, please remember, for case studies, we are concerned more with medical terms for this course. Now, these cases have been taken from some of the book, and if you read it, the topics, they are herniorrhaphy and vasectomy. And now you should be familiar with these 2 terms. Herniorrhaphy, anybody can recall what herniorrhaphy will mean?
Surgical repair of hernia.
the repair of the hernia. So any normal structure of the abdomen which is pushed out over the skin through any region, for example, umbilical region, inguinal region, or femoral region, we call it hernia. So when we repair, put this protruded part back into the abdominal cavity, we will call it herniorrhaphy. Vasectomy, as we have talked now, this is the cutting or ligation, either to tie up the vas deferens or to cut the vas deferens, to stop the sperms to reach out, to ejaculate. So vasectomy, as we have talked, is a process of contraception. So if you read this case, this all cases there to increase your awareness of the knowledge. So we have got 48-year-old married dock worker working on the seaside, 3 children, developed inguinal bulging the swelling. So in the inguinal region, the region between our abdomen and the thigh, leg, lower limb, there is a swelling and pain on exertion. When he works, he feels pain, and especially when he lifts the heavy objects, any big heavy weights he tries to lift it, then he gets the pain. Name is ED. And occupational health service advised a surgical referral. So he was referred to a surgeon. The surgeon diagnosed ED with bilateral direct inguinal hernia. Please look at the words. We will not describe all this, but we know that the hernia is there. Normal structure has come out, protruded out. It has come in the inguinal region. So when we study more, we will know that what is bilateral means on both the sides. So on right side, left side, he has got herniation of a normal structure which has been protruded out. And what is suggested that not delay surgery. So it will be pushed back. Herniorrhaphy will be done to put it back into the abdominal cavity so that he becomes quite normal. He was scheduled for bilateral inguinal herniorrhaphy and elective. Look at the words elective vasectomy. So elective is when we will take consent from the person, from the patient, that we will, if he allows for the cutting or ligation of the vas deferens. During herniorrhaphy procedure, an oblique incision was made in each groin. So groin is the region between lower part of the abdomen and the thigh. So this region, an oblique cut was made. Incision is cut. So this is actually, these are all new words which are added to your vocabulary, to understand. So we have spermatids, the incision continued through the muscle layers by either resecting or splitting the muscle fiber. When we cut through the body, either we will move the muscle away or we will cut the muscle. So the spermatic vessels and the vas deferens were identified. In this region, by the passage, as we have seen in previous slide, it is crossing to the urethra, to the penile urethra. So we can see there. We have got some names of the muscle. You have not to remember these names in this course, but this is just when we will have more study. The vasectomy began and identified in the with identification of we will identify vas deferens. The surgeon identifies this and then it will either ligate it or it will be cut. So this is the process. Now look at the second case, benign prostatic hyperplasia with TRUP. Now with all these terms, we are familiar. Benign prostatic enlargement. The prostate is enlarged, causing problem with the urination. So this person has to be relieved from this problem. And relief is that we have to cut this gland. Resection has to be done, and we will go through the urethra. So we will perform transurethral resection of prostate gland. Transurethral, through the urethra, through the penis, we will put a special instrument and then it will cut. So if you read this case, CS, a 60-year-old businessman, saw a urologist with complication of decreased force of urine stream. Look at the common English words. the person is unable to pass the urine properly. When he passes the urine, it is not, the stream is not forceful. Normally, when urine is passed, it comes out with a force. So due to the urethra is compressed by the gland, this is the urethral opening, and we have got the prostate gland all around. If it becomes big, it will make this opening small. So this will allow, urine will not pass freely through this space, because it, instead of this size, it has become very small. So urine has to be pushed through this small space. So the stream, when the urine is falling down, this becomes weaker. So decreased force of urine, even person, the patient has to squeeze to pass the urine. And ejaculation, hesitancy. Hesitancy means that he has to pass urine with surah, with urgency. Sensation of incomplete bladder emptying, and when he has finished with the urination, he has passed the urine, still he feels that some urine is left in the bladder. Some urine is left in the bladder. So he claimed that he has taken prostate health herbal supplement. There are many medications are sold in the market with the claim that herniation will become, this enlargement of the prostate will be cured by taking some pills, but it is not true with all these medications. And any real benefit, 2 years making the appointment. He denied dysuria, painful. Dysuria means painful urination. Hematuria, blood in the urine, or flank pain, pain in the sides. He has no history of urinary tract infection, epididymitis, prostatitis, renal disease, or renal calculus. Now, please remember, in your you have to be familiar with these terms: epididymis, prostatitis, renal disease, or UTI, for example. Then the calculi, we have seen renal calculi. What is the renal calculus? Anybody who can tell me?
Stone.
Stone, yes, stone in the kidneys, renal kidneys. Stone can also be in some other place. In GIT system, we have talked about this. Where stone can be in the GIT system?
And the gallbladder.
Yes, gallbladder. Polylithiasis. We use the term polylithiasis. So he is not having such problem. So what was done? Rectal examination, per rectal or digital rectal. Through finger, the doctor checked the prostate gland. And he revealed, the doctor found that 50-gram prostate and slight firmness in the right prostate lobe. Now, these are the findings actually. With cancerous enlargement, the gland becomes very hard, while with benign, it is not so hard. But if it is firm, it is mostly not cancerous. Bladder ultrasound. Now, it was another investigation was done. Urinary bladder, we had a picture of bladder through ultrasound machine. Showed no intravesical lesion. So it was not intravesical inside the bladder or prostatic protrusion into the bladder. So if the prostate is enlarged, it can push, it can press the urethra, but it can, here is the bladder, urinary, so it can push into the bladder. So that is not there in this case. Bladder ultrasound does not show this. Mr. CS was diagnosed with benign prostatic hyperplasia with bladder neck obstruction, and he was scheduled for a TURP, transurethral resection of prostate gland. What does it mean? We will go through the penis, put a cystoscope and a machine and a special instrument to cut the gland. Then third case about circumcision. So this circumcision, the Arabic word for this, we use khatna. So this is a religious binding on Muslims and Jewish. If you look the case, they have given 12-year-old Jewish Russian immigrant. So he is by religion a Jew. So they are preparing for his bar. This is some procession, some festival for children. For example, we have, for our children, we do like this to start with the Quran. So we have a special in Muslim. When we start with Quran, that means we have started learning now. So he has been circumcised for 8 days after his birth. So this is a Jewish traditional, but it is in Muslims also. We had become able to practice his religion within the formal Soviet system. On recommendation of his Rabbi. Rabbi is the religious leader for Jewish people. His family brought him to a urologist for the referral surgery. The phallus and meatus was normal and without a lesion. He had no sign of discharge, phimosis. The urethra, the tip of the urine of the penile urethra becomes small, balanitis, swelling of the urethra. Surgery for an adult circumcision was scheduled. Then he was, because of 12 years, a surgery was done. So this is the position of the surgery. But out of this, for example, you must be familiar with supine position. When the person is lying on spines, facing upward, we call it spine. What is opposite position to the spine? Anybody who can tell? Opposite to spine position. In spine position, we have our face upward. We are resting on our back. What will be the other position? When we are resting on our face. So face down position. What is the term for this? Anybody? We have talked in anatomical term lecture. Are you familiar with the word prone? P-R-O-N-E. So prone is the position when we face down. So spine is the position when we face up, lying down, lying on our back. If we are lying on our face side and stomach, thorax and stomach, our back is above. So this is prone position. So spine and prone. So this is you have not to be familiar with this, but terminology you have to be familiar. So these 3 cases for this. Now there is some about question about this case, and many we have described. For example, the term for male sterilization surgery. And we have used the term and understood the term of sterilization. A person is sterile when he is unable to produce children. So for this, what we will do? Herniorrhaphy, circumcision, vagotomy, or vedectomy, or vedovagectomy. Vedectomy for. Out of this, what should be the answer? Now you should know it. Okay, you revise the previous slides, then you will, but the key is there over here also. So with all these slides, we will, for example, you are now not the BPH term is the commonest term that we have used in this lecture. Benign prostatic hypertrophy. TURP we have used, transurethral resection of prostate gland. So we will see, so please see these terms and revise them. So we are concerned mainly with terms. You should be familiar with these terms. So this is all this over here. So thank you very much. We stop at any question, please, about previous slides. Any question in your mind? Thank you very much. So we stop sharing.
Doctor.
Yes, please.
I have a question.
Yes, please.
Give
Go
me a
on.
minute. Look.
Go on. What is the question, Omar? Yes, please. Go on.
I'm looking for it. I written
Yes,
it in
please look
paper.
at it.
Just give me a minute.
Yes, please. Wait. Next person, Rayan, please wait. Let Umar complete, then we will go to the next question.
Let's Ryan give his point because
Okay.
maybe
Okay. So, Miss Rian, you can, or Hala, please. What are the questions?
Doctor, you told me I sent in your email because quiz 2.
This is not the forum to talk about this. Please, I received your email.
Okay.
Any question regarding this lecture? Because the lecture is being recorded, so please restrict
Yes,
your questions.
there's a question about the
Yes, please.
lithotripsy. Is it a
Lithotripsy.
surgery or waves?
Yeah. So this is for the lithotripsy. To crush the stones, we have some machines which give out rays. These rays are passed from the abdomen and they will crush the stone. So big stone will become into small particles, small zarrat. So that can pass through the urine.
Is it by a surgery or without?
Not surgery. It is just a machine rays like X-ray. When we take X-ray, have you seen some person with X-ray taking X-ray?
No, I didn't, but I know it, I saw it with a picture.
Oh, it is not a surgery. It is just we place the person on the bed and pass the rays from above. These rays will crush the stones from outside. And then big stone will become into small pieces and will be passed through the urine.
Yeah, so this machine looks like
X-ray machine. It is a big machine with X-ray, like X-ray machine.
Thank you very much.
Okay, next person. Yes, please.
In TURB.
Turbo,
Removal. Removal gland or part of gland.
We can, this will depend upon the size. If it is very big, we will remove more. If it is very less, we will remove a part of resection means to cut. So decision of cutting means that we will have to decide according to the enlargement. According to the, if it is cancerous, it must be removed all. Nothing should be left because cancer is a dangerous thing.
Yeah. Thank
So
you,
it
doctor.
will depend upon the condition.
Thank you, doctor.
Next, please.
Doctor?
Yes, please.
On slide 7, we've got disorders. Are they all important and their abbreviation?
Yes, please. But which abbreviations?
Not the abbreviation, but all the disorders. Are they important?
They are, you should be familiar with this, I mean, but not at this stage. You can ignore them also at this stage, but they are important, of course, for your further knowledge.
Okay, thank you.
Any other question, please? Okay, thank you very much. Again, please, on the first slide, you have the link. This lecture, recorded lecture will be uploaded there. Okay, thank you very much.